Hello, my name is Marlena, and this is my video blog on my research proposal entitled The Influence of a Therapeutic Relationship on SA Treatment Adherence. My research questions include: is treatment adherence improved by a therapeutic relationship? And is establishing a therapeutic relationship hindered by interpersonal or childhood trauma? My literature review is derived from Blakely and Grosher's 2020 study on abuse among African American women, and the article is entitled "Keeping It Real: The Relational Effects of Trauma Among African American Women and Their Substance Abuse Treatment Counselor." Journal of Interpersonal Violence, Volume 35, 17 through 18, in pages 3405 to 3436. Blakely and Grosher's study was a case study that used 26 in depth interviews among African American women. And the data analysis revealed three primary kinds of relationship women had with their substance abuse counselors, including reparative, damaging, and transactional. The study did conclude with indicating that a therapeutic relationship is a significant predictor of treatment engagement completion. That piqued my interest to study if this was true if you had a diverse population and if you used a different type of test study. My hypothesis: relapse probability may decrease if the client has a therapeutic relationship with their client. The null hypothesis was relapse probability may not decrease if the client has a therapeutic relationship with their counselor. The design of the proposed study was a between groups design. The data collected was measured to calculate if there was a relationship between the independent variable, or the therapeutic relationship, and the treatment adherence, or the dependent variable. Measurement included identifying the variables of interest, operationally defining the variables to allow them to be measured within the sample, and collecting the data that was used for analysis. And that comes from Hapa et al. 2013, page 119. The participants and recruitment were used from the counseling group in Hagerstown, Maryland, and this agency was the counseling setting. The agency served 500 patients, and of that, 100 participants were selected from graduating from the SAIOP program, which is a substance abuse intensive outpatient program, and they would have graduated between June and December of 2019. There were 50 males and 50 females, 45 identified as Caucasian, 35 identified as African American, 12 identified as Hispanic, 4 identified as Asian, 4 identified as Native American. The participants agreed to participate. They were diagnosed by a licensed clinician as having a substance abuse use disorder, and it was leveled as severe, and they were leveled as needing intensive outpatient services. The methods of collection included CARTS, which is an informal instrument to screen for childhood trauma, and TABS, which was a formal instrument to screen for relationship issues due to traumatic experiences. Patient satisfaction surveys were used in the form of 4-point Likert scales to determine the relationship between the client and the counselor. And then there was an assessment of treatment adherence through data collection. Positive treatment adherence outcomes were assessed by as being compliant with treatment recommendations by looking at the length of the participants' sobriety through blood test, the quality of interpersonal relationships, the functioning at work or school, their social life, and by calculating all factors adhering to the treatment recommendations. A quantitative correlational research study was used as a statistical analysis, and the biblical integration was simply from Proverbs 13 and 7, which says, "An unreliable messenger stumbles